Okay, trying a second time. I'll give it just a second and see if it's coming through for people. My name is Claire McLean. I'm a physical therapist. I'm one of the founding members of the Neuro Collaborative. All right, I see a few people are joining. Yeah, definitely give me a thumbs up if you're able to see me. Okay, very good. Working now. Okay, so I'll get restarted on that. So, like I said, my name is Claire McLean. I'm one of the founding members of the Neuro Collaborative, and we are a group of physical therapists who are really interested in spreading the word about neuro-PT, neurophysical therapy, and really healthcare in general, and how awesome it can be working with people who have neurologic conditions and really helping them live their lives to the fullest. And we want to help other physical therapists and healthcare professionals navigate both kind of the clinical side of being a really good physical therapist, and then also the business side of thinking outside the box in terms of the way practices can work and how, seems to still be having some challenges. Let's see, I see a few people on there. Give me a thumbs up if you can see me. Oh, this is challenging to try to figure out this technology. Okay, we got another person joining. Hey, Michelle, if you can see me, please give me a thumbs up. Okay, I got another thumbs up. I'm going to keep going. Okay. So we here at the Neuro Collaborative, like I said, we are trying to really just improve physical therapy, neurologic physical therapy, and build this community where we all can share ideas and share experiences and help each other grow. So I wanted to share today an experience that I just had. I got back this week from something called the Power Retreat. And I think if you've seen any of our videos before, you know that I work closely with an organization called Parkinson Wellness Recovery, or PWR. And PWR is a nonprofit based out of Tucson, Arizona, that is all about bringing evidence-based, unique exercise and therapy experiences for people who have Parkinson's disease. And so one of the unique experiences that they do, they have a gym in Tucson that's only for people with Parkinson's. They have exercise classes 6 days a week, about 6 classes per day, and then they also do individual physical therapy. They do exercise intensives for people who come in from out of town, really just trying to do things that are new and different, and try to really improve the care that is available for people with Parkinson's and use the evidence to support what they're doing. Another unique experience they do is I am still here, Michelle. I see that you lost the connection though. But hopefully, well, regardless, I will make sure to post this video later. I'd love to have people on live and be able to ask questions, but at a minimum, I will post the video so it'll be available later. So the other unique experience that PWR does is an exercise retreat that is once a year. It's a week long in Scottsdale, Arizona. It's for people with Parkinson's. So this year we had 51 people with Parkinson's, 35 partners who are mostly spouses, but some adult children or siblings or close friends or a cousin. And then we have 18 staff and volunteers who come both from the PWR Gym in Tucson, and then volunteers who come from all over the country. We even had one volunteer this year from the Netherlands. And our participants are from all over the country. We also have quite a few people who come from Canada. We had some people who came from the UK this year. So it really is worldwide. So we do this exercise retreat once a year. It's a week long, and we do 3 to 4 hours of exercise per day. And then we do educational programming in the afternoon. So we bring in outside speakers, we do some of our own lectures, and we try to cover as many different wellness topics as possible. So it's pretty cool to say, you know, what are the things that we think people should know about and actually experience and try, and be able to bring that all into 1 week experience. And it's just really amazing to see how people grow and change from when they arrive at the retreat till when they finish, and that they're going home with hope and inspiration, and just really, you know, not thinking that this diagnosis of Parkinson's is a death sentence for them, that they're, you know, feeling kind of that their life is over. So it's really amazing to see that. I was saying on the first video I tried to do that we have people, so 51 participants, people with Parkinson's, and there's a huge range from someone who was just diagnosed in January to someone who's been diagnosed for 30 years. So obviously I would say anyone who's been diagnosed for longer who comes does have access to exercise in their community, and that's why they're doing as well as they are with Parkinson's, living with it for so long. But then a lot of people who come are more kind of in that 5 to 10 year range, and it varies a lot. Most of the participants, I would say, were pretty active at some point in their life, but a lot of them are not necessarily exercising now. So it is just this really amazing experience. It's so special to do all of this exercise with people, and then we get to spend the whole day with them. So, you know, depending on where you work in the healthcare system, if you're an inpatient, you may see people for longer periods of time throughout the day and kind of see how things like medications work. But for the most part, if you're an outpatient, we see people for short amount of time during the day, and we don't really see this experience that they have with Parkinson's. That really can vary throughout the day, and it's really interesting to actually be with people and see it and experience what they go through every day. And, you know, we had certain times of the day that many alarms would go off and everybody was taking their medications. But it's also nice because it's this really comfortable environment that everyone can do that. And, you know, nobody's worried or, you know, wondering what's going on. So it is this camp experience that both is really wonderful for the participants who come, and then it's really wonderful for the people who come and volunteer and work at the retreat. It's a very unique learning experience where you're working with people for long periods of time every day, seeing, you know, what their day looks like, and then also being around other therapists and fitness professionals who are really passionate about working with people who have Parkinson's. There are people just doing amazing things in their community. From one woman, Marge, who's in Rome, Georgia. She's really the only therapist for many miles who specializes in Parkinson's, and she has just been doing amazing things, seeing people for therapy, getting classes started. They're so busy they hired another therapist, and they're really growing. So it's awesome to get to spend this time with people and hear about what they're doing and share ideas and grow. So for us volunteers, it's really an amazing experience as well. So it's really unique. And with Neuro Collaborative, we would love to hear if you're involved with anything like this. I would love to hear if there are other, you know, retreats or boot camps and things like that that people have done. I know a Parkinson's organization in the LA area did a cruise a few years ago. I did not attend, but it sounded like that was pretty cool. So I would just love to hear if anybody else has experience with these kind of unique exercise opportunities. So we wanted to talk both about kind of these unique experiences, although not everybody obviously is going to organize, something like this. It's very unique, and it takes a lot of work to schedule and organize and do everything it requires to put this event on. But there are many versions of this that you can do a boot camp throughout the week and maybe really do higher intensity. Or there's also a hospital system in Arizona who's doing intensives for people when they come in and get started with exercise. They come 2 weeks in a row for 5 days each week and have 2 hours of therapy. It's a mixture of physical therapy, speech, and occupational therapy, but people get 2 hours every day, and they have been tracking their results and really showing that in the same number of visits, people are having a much bigger improvement than they did when the visits were more spread out. So this is something where, for the healthcare system, trying to think about, you know, what is really best for people, how do they see the most improvement, what works best for people's schedule, you know, not just going with this traditional 2 to 3 times a week for 6 to 8 weeks that is so common now. So we really want to think about what is the best for people for various reasons, both for you know, what does the evidence say? And then also, obviously, there are logistics and what works for somebody to come in. You know, for some people, if they're coming from further away, maybe they do come once a month, but they know that their responsibility is to then be continuing with this exercise on their own at home. But you can really provide them a lot in that once a month meeting. Or, you know, maybe you can start to do some of these intensives to get started with exercise. Maybe you offer that, you know, a certain number of times per year, and that's a way that people can come in and get started and then continue on their own after that. So just to kind of get the creative juices flowing about ways that these types of things can be offered. And then Let's see. It really, yeah, the retreat brings up a lot of topics that I would like to talk about. So they'll be my topics going forward, probably for some Facebook Lives. And I know like this idea of intensives and coming in and doing things more frequently is also something that reactive physical therapy and wellness is doing. I know recently they had someone who came down and stayed, I believe it was for about a month, for some intense therapy, who was coming from out of town. Because for things like dystonia and these less common movement disorders, for many people in their area, there is no one who really understands what's going on or can help them. So we want to spread the word both so that patients and people with these diagnoses can find good care, and maybe that requires going and staying somewhere for some intensive therapy. And then we also want to spread the word to therapists to learn about this and, you know, really enjoy working with these unique and different populations that maybe are a little bit less common. So some of the topics that we will probably cover at some point in the future, either here or in some fashion between reactive, Claire McLean Physical Therapy and Wellness, and Invigorate. One really important one we want to talk about is medication optimization. So especially for people with Parkinson's, this is really key. And as physical therapists, we have a great ability to help people figure out how well they're doing with their medications, and then what do they need to talk to their neurologist about to, you know, really get their medication optimized. Obviously, we're not the ones who are prescribing medication or making any changes, but we can really help people figure out what they need to talk to their doctors about, because, you know, we just have a big advantage. We get to spend a lot of time with people, and we are seeing them at different times of the day, and we're seeing them with, you know, exercise and with movement and doing different things. So that is a really important topic, and I think any therapist or healthcare professional who works with people with Parkinson's should really learn as much as they can to really help people get optimized on their medication. We've talked a little bit about nutrition before. That is another, you know, important topic that we, again, can kind of help people along the path to learning more. Mindfulness and meditation. I did a presentation at the retreat about this, and it was really great. And then we did guided meditation each day, and people loved it. So this is something also that can be incorporated into therapy sessions and something that people can take home as part of their home exercise program. Talking about assessments, you know, if you're doing these intensives, what assessments might you want to do at the beginning and end to show this progress that people experience? What types of exercise do we include? So really trying to be evidence-based. At the retreat, we do pole walking first thing in the morning from 6:30 to 7:30, so using hiking poles. There's a lot of research, especially out of Europe, showing the benefits for people with Parkinson's, demonstrating improved arm swing, improved posture, decreased pain. It's a really great way to enhance walking, which is already a great exercise, but the poles really add to it. So it's a great type of exercise to do. I really love our walks in the morning. Then we also do amplitude-based training. We do the power moves as a class. We do a circuit class where we incorporate more specialty equipment to enhance the exercise, either make it more challenging by adding resistance, or in some cases, you know, support people and facilitate that movement, like using super bands or TRX straps. That class is really fun. And then we do a class called Nexus, which is combining cognitive and physical exercise together. So this is really cutting edge. If you're following Faye Horak's work out of Oregon Health Science University, they are doing a research study currently looking at really trying to combine this physical and cognitive exercise together to see, you know, what the benefits are. I will post in the comments, I'll post the links to these articles in case you'd like to go read them. It's really cool and a way to think about, you know, not just adding random dual tasks to everything you do, but thinking about what are the, you know, specific types of executive function that are impaired in Parkinson's, like attention and inhibition and set shifting, and actually incorporate those high-level skills into the exercise you're doing. So that can be really interesting and very challenging, not just for the person with Parkinson's, but also for the person teaching it. So you do really have to get comfortable with that. But just that's one of the topics we want to talk about moving into some more clinical ideas, is how to really incorporate that with the clients you work with. And I would argue, even though this research is in Parkinson's disease, I really think it's applicable to just about any neurologic condition, and there may be some slight differences, but I think there'll probably be more similarities than differences, and hopefully there'll be more and more research that comes out that will help guide us in what we do with people. The other topic that I wanted to bring up in research is work done by Dr. Frazita in Italy. I will also post some of his abstracts. They are doing really cool research and showing that this higher intensity exercise that is 3 hours a day, 5 days a week for a month is really showing these dramatic benefits for people, and showing over the course of 2 years that people who do this intense program are staying on significantly less medication than the group who doesn't do as intensive exercise, actually doesn't do exercise at all except for on their own. So I will post the abstract so you can read up on that if you're curious. And I think those will be topics that I will cover in the future so that we can go more in depth. And not to say that everybody is going to be able to implement a 3 hour a day, 5 day a week, 4 week program, but just to start to think about, if this is the research showing that possibly Parkinson's disease could be slowed, the progression of Parkinson's disease could be slowed, or at a minimum that people could stay on lower doses of medication over a longer period of time and therefore avoid some of the side effects that can commonly occur later, that would be wonderful. So we want to be sharing more research and some more clinical information, and those will be some of the topics that we cover coming up in the future. And but yeah, every time I get started talking and then it's been an hour, and I'm trying not to make this too long. So we want to do mini trainings where we just bring up some really cool, unique experiences, and then start to also move into topics on research and clinical work. So please post any questions you have regarding this video, any of the things I talked about today. I will post in the comments the links to these research articles, the abstracts at least, and some other references. And then we will have a blog up on the website as well that will also have links and more information about this. So definitely please check that out. So if you haven't already, please like our Facebook page, the Neuro Collaborative. We also have a closed group, the Neuro Collaborative Professionals. That's a really great place to ask questions and discuss and share information, and really related to anything neurologic, PT, exercise, healthcare, and we look forward to having more discussions with you. Also check out our website, iloveneuro.com. Please join our email list so that we can stay in touch. And please let us know if you are interested in any specific topics for us to discuss in the future. And again, if you know of any cool, unique exercise opportunities like this, please share it, because we would love to hear about more in other areas and what everyone's experience is. So have a good evening, and I will see you guys soon. Bye.